Uh, Good afternoon, everybody. Thank you very much for joining us this afternoon. My name is Paul Goulden. I am the head of programs and partnerships here at ILC UK, and I'm delighted to welcome you to the launch of our report, Future of Aging in an Uncertain World. We're also delighted to have Morten Nilsson with us this afternoon. He's CEO of Brightwell, who are the funders of this piece of work. We at ILC have been delighted to do this piece of work because it fits in very, very nicely with our current focus, which is on long-term thinking in longevity. How do we make sure that we're taking the actions and having the debates now that mean that future lives in the 5, 10, 20 or 30 or 40 years time are going to be better, and trying to get away from the sort of short-termist policy actions. The format of this afternoon will be that very shortly I will invite Morten to give his reflections on why Brightwell were interested in doing this piece of work. My colleague, Dr Vivien Burrows, will then present her findings. And then I'm delighted that we have a panel of experts who are going to be commenting on the report and giving their views of it. And it's great to welcome Nausicaa Delfas, who's the CEO of the Pensions Regulator, Professor Alexander Evans, who's a professor in practice of public policy at LSE, Martin Jones, who's CEO of Home Instead UK, George MacGinnis, who is the director of the Healthy Lives programme at Innovate UK, and our own CEO, David Sinclair. We will have time for Q&A at the end of the session. So all attendees, if you hear anything you want to ask, then please do put that in the chat. We will endeavour to get to that at the end of the session. So thank you very much for attending. And without further ado, I'd like to pass over to Morten, CEO of Brightwell, for some thoughts from you. Over to you, Morten.
Thank you, Paul. And good afternoon, everyone. I'm Morten Nilsson. I'm the CEO of Brightwell. And I wanted to, first of all, just thank the ILC team for your report and thank all the panelists for your time today. Before I hand over to Vivien to go through the report findings, I just want to say why we commissioned the report. And for those of you who don't know, Brightwell provides services to defined benefit schemes. Our largest client is the BT Pension Scheme, which is a closed DB scheme. It has circa 260,000 members and circa 37 billion pounds under management. The average age in the scheme is 70, and each year circa 7,000 members of the scheme die. So it's a shrinking scheme, but as with many other DB schemes, the tail is very long. We still expect to have 200,000 members in 2035 and 100,000 members in 2050. And even in 2070, we still expect to have 10,000 members. So for us and for other pension schemes, we do a lot in thinking about longevity. We think a lot about longevity risk, but we do that mainly out of actuarial models. So we don't spend that much time and perhaps feel a bit less comfortable thinking about what the life what our members' lives will look like or could look like in the future, and what their future needs will be. But of course, we wanted to challenge our own assumptions. We want to learn, and which is why we asked the ILC to do this piece of work, so we can ensure we remain fit for purpose for the long term. In common with many other DB schemes, we have an aging member base. And today in the BT scheme, we have more than 345 members who are above 100 years old. I'm sure many of those people didn't expect to live that long, but they have. And I think the point about long lives is also about the quality of the lives. And what the report is also showing is that many people spend the last 20 years of their life in pretty poor health and with quite low quality of life. And of course, what we're really interested in is, can we support a world where people have healthier lives longer? And either way, how can we support our members through and the members we serve through their life? So we're very excited about this report, very excited about the collaboration that we think is needed, and we think there's need for collaboration between government, financial services, healthcare, charities, and many of the people represented on this panel today will be able to support that discussion. So thank you all again for joining us, and I'll hand over to Dr. Vivien Burrows.
That's great. Thank you very much. And I'd just like to sort of extend my gratitude to Brightwell for supporting this project and making this work possible. It's been a really fascinating project to work on. So what I'd like to do is talk a little bit about the report, and in it what we've tried to do is paint a picture of what later life looks like today and explore how we think our experience of longer lives is going to change over the next 20 years. And for the project, we drew heavily on the knowledge and insights of a panel of experts from a range of fields who took part in this Futures workshop that we organised and was hosted by Brightwell back in April. We've also made use of some data analysis and built on existing research as well. Now, although this is a futures-focused project, I think it's helpful to start by taking a quick look back. And 20 years might not seem like a very long time, but if we think of just some of the things that have changed in the last 20 years, so for example, in terms of life expectancy, we've seen life expectancy for men increase by about 3 years and around 2 years for women. But of course, there we're still seeing significant gaps between life expectancy and healthy life expectancy. And then, of course, if we look at differences across regions or even within regions, we see even more sort of stark inequalities. We've also seen a dramatic increase in economic activity rates among older people. We've seen a huge decrease in old age pensioner poverty, but a significant proportion of adults still rely heavily on the state pension as their main source of income in later life, as illustrated by some of the figures you can see here. And then, of course, in the last few years, we've seen this huge shift in pension savings away from defined benefit pension schemes and towards defined contribution pension schemes. And underpinning a lot of these changes, we've seen changes in the way the economy operates. We've seen changes in society. We've also seen huge shifts in technology. So changes in technology have, in the last 10, 20 years, dramatically changed how we live, how we work, and how we communicate with one another. And so what we've tried to do in this project is look at some of the trends. So we've identified 24 key trends across 6 different areas. So we've looked at health and care, we've looked at how we manage our money, our personal finances, we've looked at work and learning, travel or how we get around, how we live, and our leisure and social connectedness. And I think it's very important to think about these trends. Obviously, we can't predict the future, but we can think of what the likely broad directions of travel are. And this is very important because it not only allows us to sort of anticipate and respond, but also to think about how we want to shape the world that we want to live in the future. Now, I'm not going to go through all 24 trends. These are all listed in the report with a bit sort of motivating evidence behind them. But what I'd like to do is give you a bit of a flavour of the sorts of things that we cover in the report. So one big theme is, as you might expect, technology. And if we think of health, for example, sorry, if we think of health, we're already seeing the huge potential that new technologies, and in particular generative AI, are offering in terms of supporting cancer screening or was reviewing health, heart scans, for example. So we anticipate that in the future, these new technologies are going to facilitate faster and cheaper diagnostic testing, which combined with a greater focus on prevention should mean that more of us will be able to live healthier for longer. But combined with this, we're also likely to see an increase in the number of people living with one or more long-term health conditions in later life. In the realm of personal finances, we think technology is really going to help democratize access to financial information and advice. But on the flip side, it's also going to sort of, or we're going to see an increasing trend towards increasingly sophisticated financial scams. as I've already alluded to, more and more of us are going to rely on defined contribution savings, and we're likely to see more flexibility in how we can access these savings. In terms of work and learning, it's probably not a surprise to most people here that we anticipate that we are going to have to work for longer in the future. But we'll see a lot of changes in how we work and where we work. We're also likely to see an increase in or greater emphasis on lifelong learning. So people developing new skills, retraining, learning new skills later in life. In terms of how we get around, we're predicting an increase in active travel. So more people are going to rely on walking and cycling to get around. Our homes are going to be smarter, and this will enable more of us to live independently for longer into later life. But we're also anticipating an increase in the number of people renting into later life with the obvious financial burden associated with that. So what does all this mean for service providers? Now, in the report, we identify 5 key areas of action that we think businesses and services providers should focus on. And we include some sort of specific recommendations within each. And I just wanted to sort of give you a high-level picture here. So one very important area involves the design of products and services. And in particular, we need to make sure that we're designing products and services with accessibility in mind. And this applies not only to physical products, but also digital products. So thinking about the platforms that we use to manage our finances, for example, or the platforms we use looking at train timetables or booking train or bus tickets. Building a culture of trust is also going to be very important. And this is becoming increasingly challenging with the rise in digital technologies and the decrease in face-to-face interactions. So I think there's an interesting challenge here for businesses to think about how you can build and maintain trust, not just with your consumer base, but also with your employees. Innovation is also going to be very important, particularly in supporting financial resilience. So people are going to see or face more risk and increasing financial complexity later in life. So it's important that we have financial products that can combine flexibility with security. Supporting flexibility and personalized experiences is also going to be important and across all realms. So not just with our workers, but also in terms of learning and in terms of service provision. So for example, offering flexibility by default for workers where this is possible and feasible given a business's focus. And lastly, we think, although changing technology is underpinning a lot of the transformations that we're going to see in the next 20 years, we think it's important both now and also in the future to think about how we can balance online access with in-person services. Because just as today, in 20 years, people are going to be different. They're going to have different needs and different preferences. And while online access will make things easier for many, it might not be the right approach for everyone. And we think this is something important for businesses to keep in mind. In the report, we've also drawn out a number of recommendations or areas that we think government should be focusing on. And one of these involves implementing a flexible regulatory framework. Now, of course, it's important to ensure that adequate protections are in place where these are necessary. And this is likely to become increasingly important in areas around data protection and data sharing. But we also need to make sure that the regulatory process is simple or streamlined enough to encourage innovation, particularly in areas of new and emerging technologies. Health is going to be crucial. Well, it's vitally important today, as we all know, and it's going to continue to be important in the future. And we think it's extremely important for governments to focus increasingly on prevention, because although this represents an upfront cost in the present, it offers the potential of lower healthcare costs in the future. The government, of course, also has an important role to play in supporting financial security in later life. And this could be achieved, for example, by supporting individuals in building up their assets over the course of their lives and in how they manage their assets or their finances in later life. And this could include, for example, offering a sort of integrated saving schemes, which combines saving for retirement with access to sidecar savings that people can dip into at different points in their lives. Education and skills are obviously going to be important. And here we like to highlight in particular the importance of health literacy and financial literacy, but also digital skills. And we anticipate that in 20 years, people will be, or expect people's sort of digital skills to be, don't say more advanced, but sort of be better prepared for the sort of digital future. But the key thing is, just as technology has changed in the last 20 years, it will change in the next 20 years. So it's important that we keep our skills up to date and that we're prepared or we're ready to sort of work with technologies in the future. And lastly, of course, the role of government leadership is vitally important. We appreciate that government can't do everything, and it's important that governments work with businesses and with the community. But we need to sort of tackle the challenges that are looming on the horizon. We need a sort of holistic and strategic approach, and this is something that really only government can offer. So this is sort of in a nutshell my overview of the report, and I'd just like to hand over to Paul, who's going to chair the panel discussions, and I look forward to sort of hearing your views and insights on these topics. Thank you.
Thank you, Vivi, for that overview. If I can first of all come to Nausicaa for her thoughts, that would be fantastic. Nausicaa, CEO of the Pensions Regulator.
Thank you very much. Really delighted to be speaking here today, and really welcome this report, which comes at a really significant moment in the world of pensions. With an ongoing pensions review and forthcoming bill, this is a unique opportunity for us to collectively, as Vivien says, think about how to make pensions work better for savers. And what is the challenge facing us? Automatic enrolment has created a nation of savers with more than 8 in 10 workers now investing in a workplace pension. But government research suggests that 12.5 million are under-saving for their retirement. And there are many reasons for this. As you've touched on in the report, people are living longer. They're facing cost of living pressures, and many have caring responsibilities for both children and their parents. We have falling trends of home ownership and a generation of people who missed out on defined benefits pensions and have only been automatically enrolled into defined contribution pensions much later in life. These issues are particularly acute for those born in the 1970s, women, and low to medium earners. And this complex picture means that many are wondering if future generations will have enough income to support themselves in older life. Looking ahead, what as policymakers, industry, and society do we have to do to make sure that we make workplace pensions work for savers? We have to make sure that every worker receives value for money from pensions and is supported into the right kind of retirement products for them. Spending the money you've saved into a pension is what Nobel Prize-winning economist Bill Sharp described as the nastiest, hardest problem in finance. And this challenge will require agile and adaptable solutions. And this in turn requires industry, regulators, and policymakers to work in tandem within the context of a clear, predictable, and coherent regulatory framework that supports innovation in the interests of savers. Pensions are complicated. Conceptualizing and prioritizing an income 20, 30, or 40 years in the future is difficult for all but the most engaged and financially literate savers. And as this report shows, the cliff edge retirement point is becoming a thing of the past, with people working in different ways into older life, either through want or necessity. Already, we're in a position where most don't take regulatory advice when accessing their pension pot for the first time, with last year fewer than 1 in 3 talking to a financial advisor. Instead, people chat to colleagues, friends, and family who themselves might not know where to start. We have to find a solution to help guide people towards the kinds of products and solutions for them. When we researched the pensions consumer journey, consulting with industry, many large providers said they were willing to offer more personalized guidance, but they feared straying into regulated advice. That's why we're currently working on the ongoing Treasury and FCA review of the advice guidance border and why it's so important. The ability to easily and cheaply provide personalized support tailored to someone's individual circumstances must be the goal. And with the AI revolution currently taking place, we must be conscious of the new opportunities and risks this presents in terms of so-called robo-advice. For our part at the Pensions Regulator, we are also looking to establish a new innovation team to help support product innovation. Experience would say that businesses need certainty of the regulatory guardrails, the risk tolerances and expectations before they invest in new product development. So we have our part to play, providing transparency and clarity in our regulatory approach. So the 2006 Pensions Commission and the subsequent success of automatic enrolment brought millions more into pension saving, a simple system designed to deliver good outcomes by default. It showed the power of consensus, simplicity, and certainty in pensions when it runs across industry, government, and regulators. And so what we need now is consensus across industry, government, and regulators to shape the future of successful retirement outcomes for all. Thank you.
Nausicaa, thank you so much for that. Alexander, over to you.
Thank you very much, Paul. Well, first of all, really terrific to join us. And can I pay tribute to ILC? I am a trustee, but even so, it's a terrific report. So well done, Vivien and team, and David and others, and Paul. But also thanks to Brightwell, I think, for their support for this. This is a really important subject and area. And I think, there are lots of things to commend in the report. And the first is just the importance of setting out, I know again, but setting out the analytics of where we are now and where we're likely to be next. Because I think for effective bipartisan public policy, actually it's going to be really important for people to be working off a similar evidence base of understanding about how the trends have changed, as Nausicaa very helpfully set out. That's a DB to DC trend, for example, but actually how patterns of non-cliff edge retirement are changing, how patterns of consumer adoption or indeed non-adoption of financial advice frames consumer behaviour on some of this as well. I really welcome, I think, a range of the ideas for the report. I think it's important to be thinking about the regulatory framework. Increasingly, anticipatory regulation is, I think, a field in which the UK can properly take a lead. The UK has often led in principles-based regulation. That's tended to be our approach more than rules-based regulation. And this is an area where actually we do need to have both the consistency and reliability of a predictable regulatory framework, but we also want to have the flexibility and space for innovation around regulatory policy. And that's not an easy balance to achieve. And I say that as a one-time, very distant former regulator. So I think that theme is really important. I think there's also something here about being able to anticipate rather than be shocked by the fiscal and financial implications of what we're looking at. And I think it's important for us to have an honest discussion about the potential fiscal challenge for government in terms of maintaining that trifecta of pensions. This is thinking about state pensions or indeed income support with the pension system, social care and healthcare expenditure, particularly for those enjoying longer longevity, but not necessarily enjoying healthy life expectancy. And we know, the figures, I think, again, in the report speak very loudly to that. I think there's something really important here about the opportunity as well, and it isn't just wallowing in the facts and being anxious about the future. And ILC is known for thinking about the opportunity as well as some of the risks and realities around longevity and policy making. And there is, I think, a trio here in the report that are really empowering, thinking about technology and AI, thinking about the way in which we can think about incentives differently. And indeed, the successful case study in auto-enrollment is a good case in point on that already. And thinking about public health Now, it's tough against high waiting lists to think about pathways to foster more investment in public health. But I think there are ways of framing choices for citizens in future. If you think that maybe did not attend, people who don't turn up for medical appointments in the UK probably cost the NHS about £1 billion. There's enormous expense in providing prescriptions to those with higher incomes, for example, in Scotland. So there are some choices here that can be presented as reasonable, again, bipartisan choices to citizens if Parliament and government is willing to grip that long-term agenda. And the final theme, of course, is designing long. How do we design long by default rather than by exception? One of the favourite things I teach at LSE is the change of the pension age from 65 to 67 for men, which was first discussed in March 1952 in a secret cabinet discussion, and was discussed by almost every single government since. And as we know, that policy was only changed in, what was it, 2010. So there's something here that it's been very difficult for government to grapple with anything that implies loss aversion, implies the loss of an existing benefit, the loss of an existing retirement framework. But I think there is an opportunity around long-range policy making, designing long, including around the built environment. It's nice to see that strand in the report. And here I do wonder, how do we build, and 3 questions perhaps to close, how do we build on the success of auto enrollment? Because I think it has been a meaningful and substantive success, but there's further to go on that. How do we restore a framework in which home ownership is seen as part of the economic pathway for younger people and lower income people in the UK, because of this pivotal role that home ownership will play in providing not financial security necessarily, but a greater financial base for a longer retirement. And the third piece, I think, is that lifelong learning, the ideas around passporting, the ideas around micro-learning. I'm very encouraged by Singapore's engagement here. So it's thinking beyond the skills framework and in the UK, but looking at what can we adopt, what can we borrow, what can we innovate around in terms of thinking in lifelong skills and pivoting. I meet lots of people in their 20s and 30s who want to pivot in career terms. I think we need to cultivate a conversation where that is normalised for people in their 50s, 60s, 70s and beyond. So let me just close and say, terrific report, really great to gather here with industry, regulators and the ILC, and plenty of food for thought. Paul, thank you. Back over to you.
Alexander, thank you so much. And but just before I come to Martin, just a reminder to all those watching this webinar, if you do have any questions for the panel that you'd like to put, then please do put that in the chat and we will get to that later. But in the meantime, Martin, can I come across to you?
Thanks, Paul, and thanks for inviting me on this panel. My name is Martin Jones and CEO of Homestead UK and International. And just for those who don't know what Homestead does, we are the largest provider of home care globally and one of the largest and highest quality in the UK, looking after 16,000 people to live well and safer in their own home. I'd just like to echo what some of my panelists have said. I think this is very courageous to get this report together with Brightwell. There's some really interesting findings in it, and it really brings home some of the challenges, but some of the opportunities we face, both in industry and government. If we really work together, we can make a significant difference. So I wanted to really home in on a couple of topics, if I like, and that's really, firstly, talking about perceptions. And people now, and certainly the older person today is going to be very different to the older person of tomorrow. And people really want to age well their way, rather than what we've had so far in our history. And in terms of health and care, people are now starting to think about how they can live well for longer, how they can take more preventative aspects to increase as they age. But they also want to see themselves as a valuable member of society. And I think this is where perceptions come in. I think it was mentioned in the report in terms of how we view older people and how we view older people as they age as a contributor to society, rather than people who take out of society. And in terms of what's been mentioned before, The workforce side, I think it's in terms of transferable skills, are helping people come back into work. But we've got this, it talks about unretire and people will work for longer. But what does that mean? It's not just about flexibility. It's really about how can they stay engaged in the transfer, in the skills they can transfer to a distant industry, and how they can feel engaged in terms of society. But the big thing for me was two of the big things, obviously in the personal finance. We've talked about pensions. Pensions are one aspect and how we're going to live well in later life, but they're not going to solve the challenge that most of us are going to face and how we're going to pay for our care and well-being in later life. So we need to start to work with governments as industry leaders to really have that conversation about how we age well, how we can live well, and how we can provide better financial means to do that. And pension is just going to be one aspect of that. And will it cover all our needs? Because as Morten said, he's got people in his pension scheme who are 100 years old. Who'd have thought 30 years ago that would be the case now? But the biggest opportunity I think we've got, and it is mentioned throughout it, is technology. And I think AI is some of it, but I wouldn't get hung up on AI in totality. In terms of as we age, people now, the next gen ages, are really starting to embrace technology and have done for some time. So as I said before, the older person tomorrow is the older person of today. So technology will play a massive part. But things like, we talked about driverless cars in the report, automated transportation, etc. But that's also going to manifest itself in homes, in hospitals, etc., in care homes. In terms of robotics, will play a huge role. By the end of next year, there'll be 100,000 robots put out there using AI to interact with people, do menial tasks at $30,000 a robot. This is the sort of thing that's coming in. Now, this will never replace, in terms of my aspect, that human touch. But we're going to have to use technology to supplement the workforce going forward, because there isn't, as we know, just in social care in the UK, it's 165 vacancies as we sit here today in social care, not even healthcare. So we've got a big problem with our Asian population, but we need to turn that into an opportunity. And that's where technology can play a huge part, where we use the technology to use the menial side of what we need to do to support people to live longer, but obviously still have the human interface in terms of what makes the real difference. So this, right the way through this report, there's some really interesting aspects in terms of financial work and learning and where we live and how we can adapt our homes as we grow older. It doesn't necessarily mean we move out to the homes we live in. It's adapting our homes, looking at them from a different lens. And it's in terms of how we can enable people to stay in the homes for as long as they possibly can, or enable people to move homes where they feel it's safe. But we need to ensure that technology just comes as a bit of a threat as well. It can increase isolation. So how can we keep connected with society, with where we live, which again is riddled off the report, while using the advances in technology? So a fantastic report, some really good foundations, and particularly in terms of social connectedness, that we can all lean into and have a further discussion on. Thank you, Paul.
Fantastic. Thank you very much, Martin. George, over to you.
Well, thank you very much. And I should like to join others in actually congratulating ILC for what I think is a really thorough and very thought-provoking look into the future of aging in an uncertain world. It made me think back 20 years or so and realize just actually what a big task looking forward is. And when I went back, I remembered a world we were in before 9/11, before the iPad, and when diesel cars were still good for the environment. So looking ahead, I think I see in the report the impact of 3 megatrends that have been actually quite a continuous focus for government innovation over the last almost a decade now. So climate change, AI and the fourth industrial revolution, and aging populations. And these are complex, so-called wicked issues. The United Nations say they're going to change the way we live, work, and relate to each other. And it's really easy to paint a dystopian future when you think about them. But what I think we're also great at doing is finding paths through these sorts of situations, often in unexpected ways. And so what's good about the report is it allows us to keep in mind, firstly, how interconnected these big drivers are, but also encourage us to think about how we earn, save, and spend our money is going to change. And there's an opportunity that others have already talked about in that. So having spent the last sort of 6 years working on mission-led government initiative in healthy aging, and seeing that's now once again in favour, how best should the government plan for the long term? There is, of course, I think, as Alexandra has pointed out, the ever-present tension between acting in the long-term interest and working within electoral cycles. And that isn't going to go away, neither is competition for resources. So I think first and foremost is the need to build some form of cross-party consensus on the issues that most need to be addressed. And I think I looked to the Republic of Ireland, who did this when they developed their Sláintecare strategy for health and social care, actually finally agreeing that there was something that needed doing urgently, and it was big. I think it's a bit less clear that we're on a journey to consensus politics at the moment, but actually, if you want to do the long-term stuff, that's where we need to be. But I think next, my experience of the Healthy Aging Challenge has also highlighted what I think are 3 factors that helped us move sort of in the direction that we did. The first was having a North Star, and in our case, it was the mission to improve healthy life expectancy. And you can argue by how long and by when, but I think there is broad consensus that actually that is where we need to be getting to. I think the second was to put some bounds on the action, in our case, helped by the Centre for Aging Better, to find 7 themes that had the greatest potential to address market failures and achieve impact in the time frame that we were working. And they were broad enough to spark the interests of multiple sectors and generate a community of innovators that address things as diverse as financial well-being, mental and physical health, and also vibrant communities, so housing and towns and all that goes with that. And I think then the third piece was actually having an investment approach. In some ways, this is something that Nausicaa has already raised, that was flexible, able to test and learn from experience to understand what really works. And I think there is a huge opportunity for businesses in responding to these changed market demands. So Innovate UK reflects that in a way now that we don't just work on grants for startups, we have an increasing focus on growth through business advice, by developing the talent and skills needed for the future, and also other types of funding, such as innovation loans that actually pull stuff through into the sort of scale impact that we want to see. And I think, again, as others have said, regulation will also play a part. Loved the earlier comments. Regulation really is an enabler. It's not just a blocker. And in health and care, it's also not just about defining what is safe. It includes an understanding of what we value. Essentially, businesses, innovators need markets, whether they be private consumers or government agencies. And we've been stuck in a bind, I think, with social care in particular, because we've been driven down a sort of cost-conscious, cost-saving route, securing tasks in the shortest time at the lowest possible cost, having lost sight of the value created, and on the way see often wasteful approaches meet the demand of the market. So for me, that means innovative business models that recognize the value that is being created. So I think we approach the future like explorers. We have a broad understanding of the destination, a broad understanding of the direction we want to head, and on a route yet to be mapped, so we need to be prepared for the unexpected. So back to you, Paul.
Thank you, George. And I love the image of approaching this like explorers. I'm just I think there's an ILC graphic on the way here, and watch out for that in future. But thank you so much for that. Morten, if I could come to you, obviously as CEO of Brightwell, who supported this project, you gave an introduction, but some other reflections from you, perhaps.
Yeah, thank you, Paul. So for me, I think one reflection is on tech changes, and of course, in the last 20 years, we've seen tremendous change come through from a tech perspective. In the 2000s, we had a quarter of the population being using the internet, whereas today it's 97% of the population. So it's really changed, and we see it's more personal, more portable, and of course AI is making advances we never thought possible. So of course, looking at the next 20 years, as you've started to do here, the opportunities are enormous, but of course also the expectations will be very, very different from the people we serve. So I think that's a key point for me, and something we need to think about. The other bit that the report highlights is inequality in health and wealth, as we've talked about. And of course, this likelihood that we'll see many more people renting their homes and many more people who might be in their own homes but still have significant mortgages left to pay off will require additional savings. And if you're renting in retirement, you will need hundreds of thousands of pounds more in savings than if you have paid or owned your home outright. So that creates quite a big difference. And if we look at the DC pods for the 55 to 65-year-olds, it's around £100,000. So there's a shortfall there. And of course, government is already looking at adequacy and has that as their second phase of their pension review, which I think is a good thing. But the reality, which we have to touch on a little bit, is that a lot of people will need to work longer to address this shortfall, and it will take multiple decades for savings to build up and be adequate. So I think we need to get used to that we need to save for longer. And of course, if you are living till you're 100, if you retire at 60, that's a very long time you need to pay for yourself. So that I think will have to change for many people. And in that working for longer, I think we really need to change the attitudes of old age careers, and both for the individuals and our own expectations and our own ability and willingness to think differently and accept different jobs, but of course also for employers and society we'll be living in. We need to overcome disabilities, and we need to think more flexible and work more flexibly. And from a pension perspective, I expect that will mean that savers will need to be able to dip in and out of their pension savings, which is not how we're set up today. So that requirement will mean we will need to change how we operate over time. So again, thank you for the report. I think it's a wonderful report, and back to you, Paul.
Many thanks, Morten. And last but by no means least, if I can come to ILC's own CEO, David Sinclair. Over to you, David.
Yeah, a few thoughts. I'm very, very proud of what ILC have managed to achieve over our 25 years. However, it's always very grounding when someone sends you an article from 1949, which they did this week, that said, modern medical advances have resulted in the saving of innumerable lives. However, at the same time as lifespan has been increasing steadily, there are many and varied problems associated with aging and chronic illness. In other words, 55 years ago, we were talking about the gap between life expectancy and healthy life expectancy. Today, our Healthy Aging and Prevention Index, which looks across the world, shows that basically in every country in the world, pretty much you have a 10-year gap between life expectancy and healthy life expectancy, including places like Korea that we look to very fondly sometimes, South Korea. Over the next decade, and people have touched on this, my view is we are going to see more significant change in the way we live our lives, and Martin and others have touched on this, than we have in the last decade. I think we will see driverless cars on the roads of London in the same way you already see them in San Francisco. AI will be able to deliver advice, but at the same time, I read something yesterday that suggested that within a year, we won't be able to identify the difference between an automated voice at the end of the phone and a human voice, which opens huge opportunities for scams in this space. We will have more health at home, we will have more medication targeted at the common experiences of aging, and many of us will work with robots much more than in the past. I think in the main, this offers huge opportunity, but how can we maximize them? And Vivien touched on one of the issues, but I'll pick up on one of others. The first one is clearly we need to make all of the services we're developing as usable and as accessible as possible. And I think we're much better at doing this. I saw yesterday actually on the Brightwell LinkedIn page that 2/3 of their retirees are now using their online platforms to retire from the BT pension scheme. You know, this only works if you're delivering a usable and accessible service. So I'd encourage everyone to be thinking about that. Secondly, and this links back to my life expectancy versus healthy life expectancy point, it's some of you will have seen Jay Olshansky published something in Nature Aging last week that argued that we should be very cautious going forward about claims that we're even going to be living to 100 years or years on average, and that the idea that we're going to see the rapid aging that's been predicted since the 1990s, frankly, is mathematically unlikely. His argument was, as a result of that, well, we need to focus on the improving quality of life, improving health, and for me, I think that's where we need to make sure with the innovations people like George and the government and indeed the private sector is funding, we're worrying a lot less about how we support innovations to support typically fairly wealthy men in their 30s who want to live forever, to move towards how do we get innovations and investment into more of Martin's sort of area, into the care space, into how do we live better and healthier for longer. And then the final things in terms of how you actually do that. And I think George and the team have done a fantastic job over the last sort of 5 or 6 years. I think there is still a job to engage businesses in understanding the opportunity of long lives, and innovators too. And it's a few years ago now, but I judged some awards that a telecoms company did around apps for older people a few years back, and they had about 60 or 70 who entered this competition, of which about 45 were emergency alarm systems for older people. Of course, we have no shortage of emergency alarm systems in the world, but actually part of the reason for that was because there was a perception amongst these app designers, look, older people are vulnerable, we need more emergency alarm systems. And I think the challenge is, how do we go from that to how do you engage people in Morten's industry, how do you engage people in Martin's industry, but also how do we engage the Procter & Gambles of the world, how do we engage the Googles to start to say, actually, how do how do we build their knowledge of the impact of long lives so they don't just keep creating more emergency alarms and instead are creating things that help us live better, longer, happier for longer. So I'll stop there.
Brilliant. Thank you, David. Right. First of all, thank you to all of our panelists. Very insightful there. We've got some questions that have come up in the Q&A. The first one I'll come to is just thinking in terms of that long-term thinking and the government and the political arena. The new government came into power a few months ago, clearly under that banner of change. We also know, obviously, the Conservative Party is going to have a new leadership very shortly, and in the coming months and years, they're going to be looking at what their positioning is. And during the election, we also saw some of the smaller parties, Liberal Democrats in particular, quite able to come out and suggest some of these very interesting and innovative ideas. But my question to the panel would be, across the political spectrum, how do we actually get them to think about long-term policy making when obviously if there is an appetite for change, then obviously there's a big risk attached to that as well. So how should we make the case who would like to? I'm just going to pick someone, if I may. Martin, over to you.
Thanks, Paul. Big question. I think for me it boils down to, I can't remember who mentioned, might have been Morten and/or David, in terms of currently from a government perspective, they think very, very short term, 4 or 5 years, and that's the way they're programmed. And when we're talking about an aging population, we need to break that trend. We need to break that trend in terms of being more cross-party. And I think Wes Streeting said over the weekend that in terms of from the health perspective and social care perspective, they are now starting to talk more cross-party. He's had Conservatives, Reform, Lib Dems reach out, and they're starting to look that way, because I'm not just even talking a 10-year plan. It needs to be far longer than that. We need to think about how those budgets are spent, and whether do we need to think about it the same way we thought about interest rates in the past. I can remember, I'm old enough to remember, when interest rates went up to 15% in one day because they were handled by the politicians. Now they're handled by the Bank of England, and in the main, it's done for the needs of the economy and the country. Wouldn't it be great if health and social care was taken out of the remit of the government, still had politicians involved, but had academia, commercial interests, etc., looking at the long-term health of our nation and really feeding into how we want to age well and safe? I think that would then engage a lot of the more business sector, because businesses, there's a £1 trillion economy out there that businesses are just not even engaging with. And I'm not just talking technology, I'm talking retail, hospitality, leisure, just not thinking about how people want to age well. So, and I think technology, I think we do have, as David put, loads and loads of panic alarms. I see them as I walk around conferences in my sector. We're not attracting the likes of Google, Amazon, all these big tech firms into the Asian space. We're trying to engage and reach out, but they don't see it as an attractive space. Yet, as I say, the opportunities there, the opportunity to make a huge difference is there, but it's not seen as sexy. And that then frames in terms of we need to make aging not a threat, as a big opportunity in terms of what they can contribute, but also what an opportunity it could be for the commercial sector, political sector. So for me, be good to take it out of government's hands and actually put it into some sort of other body. It really looks at the long term of our country and the long term of our people and the health of our people to live well and safe. So that's what I do. And as talking to Wes Streeting, maybe it started in terms of that cross-party alliance, but maybe it hasn't. Fingers crossed.
Thanks, Martin. That's a fantastic suggestion. I'm going to head straight across to Alexander as a professor of public policy for a response on taking that out of the government's hands. Alexander.
Thanks, Paul. Martin, I think you just suggested a job. Finally, that defined benefit job I've always been looking for. But look, so I think part of the positivity about this report as well is actually triggering a bit of a debate on this, right? So I wouldn't necessarily agree with Martin on that, but I think the issue is so important that we ought to be having robust debates about all the options and putting them on the table and properly sifting through. But if I may, I think both major parties in the UK, I was up at both the Labour and Conservative Party conferences leading the LSE's engagement as a university with both. In fact, on long-term policy making, those were dinners we hosted up there in Liverpool and Birmingham. And there's certainly appetite for the long term. The difficulty, I think, is how do you bring the long term and how do you bring longevity into the room now? And particularly, how do you do that against the fiscal environment, which, as we know, is tight and getting tougher? And that would be true no matter what flavour of government you'd have in London. But I think it is possible and plausible to do that. One model is to depoliticise, as Martin rightly says, and I think to try and think about are there ways of making it bipartisan, are there ways of thinking what would a Northcote Trevelyan report, rather than for the civil service, but for longevity and for long-term financing of longer lives look like in the UK? It's why the IRC plays such an important role. This is actually where I think the private sector perspective is so important. And I don't, honest Gov, I don't have stock in any of the companies that might benefit. I do some work for the major tech companies, but I would actually probably echo Martin. I don't think actually there's an enormous amount of engagement by the major tech companies on this space yet. But I think here what we're also interested in is innovative financial ideas, innovative regulatory ideas, and thinking about behavioural science. My 92-year-old father-in-law, sort of swears and lives by his Fitbit. Other tech is available, of course, but to what extent can we, if you like, connect the user experience and the user design around longevity with tech that can help accelerate better choices without taking away choice from individuals? Because ultimately, and I think both Morten and Nausicaa were talking about this, the difficulty of getting people to take advice effectively remains a bit of a challenge as well. And often the people who need advice the most are least likely to reach out to get it.
Alistair, can I jump in, Paul? Is that all right?
Of course, yeah.
Okay. So, interestingly, the UAE have a 50-year plan, and so it is not impossible for governments to think about this. I started last night rewatching The Diplomat, which is a fantastic series on Netflix, and I would encourage you to have a look at it. But actually, part of the argument, or the underlying argument, is that they put someone in a position on the grounds that anyone who wants to be a politician is almost certainly the wrong person to govern. And it's a really interesting thesis, whether or not you believe it. I suspect if the Rory Stewart argument is that he wanted to govern. And I think there's a really interesting question there. In our route map for long lives, we talked about the case for having a parliamentary cross-cutting select committee akin to the Environmental Audit Committee. So I think there is a role for Parliament as well as government here, and I think Parliament could help. I think the thing I would say to politicians in terms of how to get them on board is that I think we actually have a more grown-up electorate than sometimes our policymakers give us credit for. We 3 or 4 years before a smoking ban, there was a sense of outrage that this would never happen and people would object to it. And you know what, people did it. Same with plastic bags. The front pages of newspapers objecting to this. It was objecting to relatively small changes, huge. And my sense is that politicians have a role to lead, and that actually our job is to support them to make those difficult decisions sometimes. And so maybe one of the messages for ILC is we need to support the new government and the opposition to say some radical and bold things that will be almost certainly truly pushing the Overton window and unpopular amongst the population.
Thank you, David. If I could just come on, just sort of expanding this conversation away from government and maybe into business and industry. And one of the questions on the chat has very much asked about if big retailers, and I think Martin sort of touched on this, if they've embraced the idea of climate change under their ESG as being something that they really need to be very focused on, how does that enlighten how we might make the case about longevity? Does that teach us anything about how we engage with those? And I think a follow-up question to that on this sort of how innovation happens within the private sector and how that will sort of link into how we grasp longevity over the long term within business. How do we make the case further, I think? And if I could come to George and Nausicaa on that. George, obviously from the innovation side, and Nausicaa, just that sort of the regulation and regulation as an enabler as well, which I think was an interesting angle. And so Nausicaa, maybe you first, if I may.
Yeah, thank you. So really interesting question. So I absolutely do see regulation as an enabler for a variety of issues. So you mentioned about ESG being a requirement in some in industry, but so that's why it's so important that we have consistent regulation as well around the longevity issues. I did want to touch slightly on the comments we were making earlier on the previous one, if I may, that I think now is an opportunity with these pensions reviews to try and coalesce around that enabling regulation and that enabling long-term view. And I think what's incumbent on all of us is to help the government by providing evidence. This report is very helpful, but I think that is what they're really interested in. And I think that from my experience of speaking to these ministers and the ministers from the previous government, there is a real cross-party consensus. So I'm really optimistic that we could, with evidence, help move forward. But as I say, in terms of how do we move industry forward, it has to be through sort of clear and transparent regulation, and that's what we're really interested in, working with you all at the Pensions Regulator to achieve that.
Thank you, Nausicaa. George, on the sort of innovation and kickstarting side.
Yeah, so I think there's a truism that we're talking about with business, that follow the money, and businesses that lose sight of that actually lose, don't they? And I think there have been some signal events in I knew that BT entered the older care space for a bit, and then O2, and then pulled their products because they weren't working. And when I took over this role 6 years ago, I took over a sketchy business case that outlined that success would be seeing products for older people in 4 major retailers. So in about half an hour, I'd found sections in the Argos catalogue and B&Q that did exactly that. So we think, that's great. So I've got £98 million and I've been successful already. But actually, the problem is that those products other people. So firstly, the thinking is not about making things dedicated for older people, but making things in an inclusive way that is truly intergenerational and has broad market appeal. So I wouldn't expect Amazon and Google to suddenly become old friendly in that sense, but we'd want to see them understanding how to tap into a much broader market than they are able to, and one that your previous work, David, has highlighted quite how valuable it is. So is ESG the route? And declare an interest. We're members of Business for Health, which is trying to get H into BSG, amongst other things. But I think it's a double-edged sword in some ways. I don't think ESG is the one route to do this by. I think businesses will follow it because it makes them more attractive to the talent that they're trying to recruit. It might align with some brand values, but it doesn't answer the fundamental question: are we going to be a successful business? So it comes, I'll come back to that intergenerational thing, and then the last point that I would make, and I see she's on the call. So Judith Phillips is a big sort of advocate for really thinking about place. What is the impact of all these changes that your report highlights on the places where we live? And what does that mean to businesses in retail and all sorts of other things, businesses in hospitality? And, are we really sort of thinking about the opportunity about where people want to live and enjoy their life well enough? And Martin, do you want to live in a care home, out in the country, remote from anything, or one that's in a town centre, just next to your supermarket and coffee shops and things where people can come and visit? So there are lots of drivers, and we need to help businesses understand what they are and how to tap into them.
Thank you, George. That's fascinating. The question in the chat that sort of links on from that in terms of the we know that the spending on health and adult social care is squeezed because of councils' other obligations. We've also heard that we know that tech is on the way, although slight insight into the working of ILC when the announcement was made over the weekend about West Streeting and technology coming to the rescue of adult social care, there was a big sigh on the WhatsApp group, because we've seen this many times before, and I think we might want to pick up on how we actually make that a reality. But I think what the question on the chat, and one that I think is very relevant, is how do we bridge that funding gap while tech steps in? So over the next 10, 20, 30 years, how do the two of those mesh together? Or is one waiting for the other, or how will that sort of work? So Martin, again, could I maybe come to you first on that one, just on that how we see tech and then the funding actually, how are they going to develop? How do they need to develop?
Okay, in terms of the funding, we all know we've got an amazing pressures in this country for some considerable time in terms of the gap, not just now, but we've had for some time. I think for me, health and social care have actually got to start to work together, and we're putting the cart before the horse. So we're always talking about health in terms of the NHS side, which is the fix rather than the preventative side. So we have to look at what limited funds we have is spent, and it has to be spent and focused more on prevention rather than cure. I think that's critical. I think we have to look around the world at different how different countries have approached this. If you have a look at Australia, whereby they've very much looked at choice, and Germany's quite similar in the sense that the money will follow the person rather than the way we do it through some homogenous commissioning group. So I think it's how we spend what limited funds more wisely and more effectively, and look at outcomes. I think it was George you mentioned before, in terms of we're too focused on cost. And if you're focused on cost and having the lowest common denominator, it's a race to the bottom, and certainly a race to the bottom in terms of outcomes and quality of care that people have. And then that puts pressure on the other side of the coin, which is health. So we have to look at things differently. We have to be brave that actually spend more upfront in terms of prevention will actually make what limited funds we've got stretch even further. I think in terms of technology, it's not going to come tomorrow. There's no doubt it's not going to come tomorrow. I think AI will have a massive, significant effect in terms of how we can support people in both social care and health, and we're seeing some robotics in terms of operations, etc. at the moment. But I think it's going to be about, I think again, maybe George or somebody else mentioned it before, how can we use what we've already got in terms of technology to help us stay well and self? And it may be this Fitbit, other providers available, as we said before, but there's a lot of things in our homes now that are Wi-Fi enabled that could help and give us useful data in terms of nutrition, in terms of whether you have enough to drink, etc. How can we use the Ring doorbell, all these sort of things? There's a lot of things actually in our homes now which are Wi-Fi enabled, which actually could provide some data which could help us in terms of the way we live. And then yes, robotics, etc. will come. There's no doubt, that will happen, and it's got to happen because of our aging population, and obviously in terms of there's more people are older than younger at the present moment in time. But I think back into the funding, it's using what limited funds we've got more available in a very, very more radical way, and giving people choice rather than what we've got at the moment, which is very much do unto people, which is a bit like our tech. We do unto people. But so that's why we've got so many panic alarms everywhere. So it's really involving old people in the conversation.
Thanks, Martin. Morten, can I come to you?
Yes, a couple of thoughts for me. I think one people are asking also about the funding gap in all of this and the cost of social care, etc. And I think for me, back to the working for longer bit, I think working for longer is an opportunity to support growth in the UK. And I think it's also people working longer are generally, all the research I've seen, is showing they're happier, they have purpose in life, they live longer, and they contribute. And as I say, that is for me one way of contributing to the economy. And if you can then support that via supporting people in addressing any disabilities they may have, and also supporting them in as I talked about earlier, being able to stretch their pension savings a little bit longer by dipping in and out of that would be helpful. I suppose the other thing I would say is we talked about ESG, or one of the questions or comments was about ESG and climate change and what has driven that. And I think a lot of drive has been, quite a lot of financial institutions have seen quite a lot of opportunity in climate change and investing in climate change. And I see quite a few private equity funds that see an aging population as a huge financial opportunity. And I think that will drive quite a lot of investment and quite a lot of progress. And again, I think that is perhaps part of the link. And I also think there is, if we look purely at ESG, there is a real focus on the S and how you go into that social side of it and address that. So I think there's a bit of opportunity in there. And the final thing I want to add to some of the other comments is, I think quite a lot of the technologies that are being developed, they might not have been developed for the older generation, but they're pretty useful for the older generation. So being able to quite cheaply now transcribe a conversation so you can read it if you can't hear it, that those technologies are getting cheaper and cheaper and more available, or vice versa, they can read it out loud, just to mention some pretty simple examples. But I think that will, although quite a few of those technologies are already available and much more cost efficient or easy to fund, and I think that will give a better service and allow older people to be better supported in making self-service choices, and that again will give them a broader support group, and actually probably help them make better choices, because you can now combine multiple channels at once. So I think there's a lot to be positive about in that regard.
Thank you so much, Morten. I'm just conscious of time, so I don't have any time for any further questions, but thank you for those that did ask them. We will have a look at those, and we may come back to you offline about those. Panelists, may I just come to you for one final thought before I wrap up? Nausicaa, you first, please.
Yeah, thank you very much. Well, and for such an interesting discussion. I think if there's one thing that this report shows, is that there aren't any easy answers. So I think the one thing that I'd most want is for us to achieve consensus on how we can move forward in this difficult area. Thank you.
Thank you, Nausicaa. David.
I think it would be fantastic if every business had someone who understood demography and long lives from a broad marketing, but also from a broad product, and not just have one person shoved in the ESG department who has a bit of a responsibility for older workers. And then similarly in government, it is striking how few people in central government know very much at all about demography. So I don't think there is anyone, as far as I know, in the Department of Culture who has a responsibility around health. I don't believe there is anyone who has a very strong knowledge around in the Department for Transport beyond the concessionary affairs teams. I think we need to make sure that the expertise in the chief scientists in government departments really gets out to the government departments, so every bit of government is thinking about long lives, not just DWP and DH.
Thank you, David. George?
So I was sort of going to echo a word. I think that at a high level, I think the real ask is to maintain a focus on aging populations as an opportunity, and that's both in government and in business.
Thanks, George. Martin?
Mine's quite similar to George's, actually. Let's not have we've got a very ageist view in this country. You know, in terms of where you perceive aging, you know, you buy a card for 60-year-old and it's pipe and slippers. That's not the case. So it needs to be seen as an opportunity, both, as George said, in business and in government, and in the community as well. Older people can give a lot back.
Thank you very much. And final word from Morten.
I really like what both George and Martin said about thinking about old age as an opportunity, because we've been thinking about it as a burden for a very long time, and I think changing that narrative will drive a lot of positive developments. So really agree with that. The only other thing I would just add is, and Nausicaa touched on that, but this regulatory framework to support better use of technology, I think is really quite critical also.
Thank you so much. Well, thank you to all of our panelists. Just a few words that jumped out for me. Alexander talked about designing long. I've said it before, I do like George's vision of us in the longevity space, approaching this in like explorers and thinking about, you know, that uncharted territory that we want to be getting into. Nausicaa, the idea of regulation being used as an enabler rather than a prohibitor, I think, is something that is fantastic to hear. I think it's a feeling we probably need to work a bit more on and challenge that perception. And Martin, certainly this idea of those perceptions of older people, and Morten mentioned, reflected this as well. The opportunities for us as we age do not change. We need to change how we actually approach and look at people as they age in order to enable them to do more and to get the most out of them for our communities. So thank you all so much to our panelists. Some final thank yous from me. So again, thank you to Brightwell for the supporting of this report. Thank you to all of those who actually attended the events, the roundtables, and various that actually were involved in putting it together. And thank you all for attending today. As with our longevity white paper last year, we used the longevity white paper to put it out there, to challenge some ideas, to get some thoughts, and to try and shape the debate. And certainly from ILC going forward, we intend to use this report in order to look at, to challenge that short-termist thinking and to look at what life might be like for us all as we age over the next 5, 10, 20 or so years. So thanks to everybody again, and we look forward to working with you in the future. If there is anything in this report that grabs you that you would like to talk to us about and explore, then please do reach out to one of us. But thank you all very much for your attendance, and I hope you have an excellent rest of the day. Thank you very much.
Thank you.
Thank you, panelists.
Thank you.
Good. No, thank you. That was